After evaluating the left side of the heart with the valves that are located on the left side, you need to move over to the right side where you can auscultate the tricuspid valve, and that is located between the third and fifth intercostal space. When finished auscultating the heart, we are going to move on to abdominal palpation. And with abdominal palpation, you can try any technique that works for you. You need to find your own way of doing it. There are a lot of different ways that we do abdominal palpation. So you can either with a small patient just do the one-handed approach, or with a large patient do with two hands. So some people use two hands and they go from the top for palpation, and other people come from the side. So I prefer to actually do it from the side and from the back. So I would position the patient facing away from me, and I'm at the back. I use my dominant hand between the legs up on the body wall, and my non-dominant hand just on the other side of the body wall. And that's how I do my standard palpation. You need to be systematic in the way you do abdominal palpation. So I usually start dorsally and also cranially. And in that position, you just need to be very careful when palpating. So don't do it too hard. You need to just apply gentle, firm pressure in palpation. So in the dorsocranial space, you might be able to palpate the kidneys. In cats, it's very easy to palpate the kidneys, but in dogs, most of the time you will only be able to feel the left kidney. Then moving down in under your rib space, you will feel for the stomach if there's any gastric distension. Then moving a little bit back again dorsally, you might feel the left kidney again in this position a little bit further back. Moving down, you might feel the liver, and usually the liver sits within the costal arch, but if it is a little bit bigger, then it might extend past the costal arch, and then you'll be able to feel the liver edges extending past the costal arch. Then moving back, you might feel the spleen, and this usually sits in about the mid-abdominal area, more towards the ventral surface. Then moving up and down again, you can start feeling the small intestines. So I try and feel all the little loops slip between my fingers as I move from a dorsal to a ventral position. Then moving back, you will start feeling the colon and also be able to assess the colon contents. And then the bladder is located in the caudal abdomen more ventrally. If you are working with a male dog and they do have enlarged prostate, you might also feel the prostate in this location. And if you have an intact female dog that's pregnant or got a pyometra, then you might be able to feel the uterus in this position near the bladder, also locating the caudal ventral abdomen.